My name is Jasmine Weiss. I'm from Charlotte, North Carolina. I'm the founder of a new company called iDream Enterprise. I have a passion for mentorship and promoting equitable access to care and upward economic mobility for Black and Brown communities. So I'm currently a pediatrician in the Department of Pediatrics at UNC School of Medicine. So I actually live in Durham. So when you said you're headed up this way, I'll be actually headed down to Charlotte and to Atlanta later this week. But I graduated from Florida A&M University, Duke for medical school, and I did my pediatrics training in Atlanta at Emory. And then I followed that with a research fellowship at Yale in the National Clinician Scholar Program. And as an aside, I'm a huge NBA fan. So Davidson, obviously, go Steph, and hopefully the Warriors do well this year in the playoffs. So I want to tell you a story of a patient that I had actually during my residency. We'll call him Chris. I was in the adolescent outpatient clinic doing well child checks, and Chris came in with his mother. And I asked all of my patients how they're doing in school. And he said he was failing all of his classes, right? And really didn't care too much about school. So I tried to put on a tactic, well, you can be a nurse, or you can be a therapist, or you can be one of the medical staff members, or you can be like me, you could be a pediatrician. And I remember him thinking about that and saying, that's really not possible. My father, my uncle, and my grandfather are all in prison. And all I'm really doing is headed that way, right? So he was really disinterested, disengaged, and really had a story that touched me. And his mother actually began to cry during the visit because she was truly at her wit's end, trying to obviously keep him safe and from moving in that direction, but just not knowing what to do. And that's when I really realized my job is more than just giving out the medications or doing the annual physical exams. There's truly a lack of role modeling and mentoring in this wide array of careers, which are health careers. And so our mission at iDream is to inspire future generations of Black students to pursue those impactful health careers. And we really want to provide career exploration for all shades of brilliance, especially those who may not commonly see individuals in these roles. And this is a huge problem in this country. There's a lack of exposure to the vibrant, impactful, meaningful careers, especially now with COVID. When you look, the Black population is about 13% of the US, but when you think about all of the different divisions in medicine, specialties in medicine, they're underrepresented in really mostly all categories. So they only make up 9.9% of nurses, 5% of doctors, about 5% of pharmacists, and 3% of dentists. And this truly is just not reflective of the US population. When we think about this problem, the lack of early guidance and access to resources and networking opportunities come to mind. If you don't see it, you can't aspire to be it, right? So there's a leaky pipeline. Students are disinterested in the sciences, are not familiar and exposed to the different opportunities early on, and you see that just dwindles over time. So when you think about who goes to college and thinks about pursuing STEM and medical careers, who gets into medical school, and then ultimately who becomes leaders in this field, we want Chris to have the same opportunities that anyone else would have. And over time, that really leads to a lack of competitive applicants being able to permeate every specialty and every discipline of medicine because the leaks are so great. So what is iDream? iDream is an online platform that connects students with professionals in our what we're calling 10-week health careers bootcamp. During that bootcamp, students get to engage with Black and Brown professionals and learn about their career, but also do something called the Stethoscope Case File series, where they actually go through real life patient cases. And then most importantly, the students get to interact and network with one another on the online platform. So users can engage in a variety of ways. So they'll be able to directly connect and talk with the professionals. And then we'll have a series called Pathways to Success, where we have speakers and experts from medical school, nursing school, pharmacy school, and optometry school coming to share, even with high school and college students, about how to get into health professional school. So they get a full array and a full idea of what it takes to be successful on this career journey. And lastly, opportunities for online networking and community engagement. With time, we hope that this becomes a recruitment tool. So we'll have the best and brightest students on our platform, and we hope that colleges and health professional schools will want to join the platform to help recruit diverse trainees. So our boot camp actually started last week, and this is kind of the lineup. So we have pharmacy, anesthesia, nursing school, nurse practitioner, which is actually tomorrow, optometry school, OBGYN was last week, medical school, and then pharmacy school. All of the resources are on the platform for the students. So they'll come to the live session on Thursday evenings, but then they get to engage in all of the content that we have on the online platform. And eventually we'll have schools be able to use this as well. So how is this relevant in this US market? Well, the educational service market represents about almost 2 trillion. And when you think about the explosion of online virtual learning, the opportunities are truly endless. We kind of fall in that category of job training, career counseling, and then educational support as well. The costs are here. So we have a model that's direct to consumer, where individual students can purchase the 10-week access for $98. And then we have schools and student organizations that can purchase at a group, basically group rates based on the number of students that they have. And then we have partnership opportunities where corporate partners can join, and we've had 2 corporate sponsors so for our F Prime Capital and the Yale Center for Biomedical Innovation and Technology help us join and be able to provide this for students who cannot afford to pay. So I'll talk briefly about our approach. So there are about 8 million households of Black and Latinx individuals that make, there's more than that, but that make 75,000 or more. So when you talk about, and when we've spoken with potential customers about, you know, can you afford a $98 price point? They mostly, this group, especially, and even across economic levels, have been able to say, you know, $98 is nothing when we think about how much we pay for summer camps and spring break camps and everything else that they pay for. So this represents a $780 million kind of market. So we did pilot this last year with 3 sessions, and I just wanted to share some of those testimonials. The first testimonial, this person said, "This session helped me completely understand the application process of medical schools. Before this, I was unsure about all the requirements and what it really takes to get into med school." Another person stated, "This session was very informative and encouraged us to never give up when it comes to pursuing a career in the medical field. The medical field may be competitive, but it's well worth it when you actually have a passion for it and enjoy medical careers." And then for our pharmacy pilot, meeting Dr. Towns today was an incredible experience and has inspired me to consider the pharmacy route. The information provided today made me feel better prepared and more excited for the career, for the healthcare field. So from that pilot, we had a 100% recommendation rate, and we will see how this is our official launch. We're excited. I'll share a little bit more. We have over 100 participants in this first camp. We're represented by African-American high schools in the area, in the Charlotte area. So we had West Charlotte High School, Philip Berry High School, Garinger High School, among other schools in Georgia and Virginia, in Greensboro, in Atlanta. And then we have 8 historically Black colleges present. So North Carolina A&T, North Carolina Central, Fort Valley State in Georgia, Virginia State. So a wide array of participants just so far in this initial, with about 6 weeks of marketing only to those specific schools. And so with that, I will pause. And if I have a moment, if I have time left, I can show you what the online content looks like. So this is our kind of platform where students get to log in. They get to kind of see how things work. There are quizzes involved.
Welcome to the Health Careers Bootcamp.
I won't play the whole thing, but just to see the experts, I think, would be important as well. Just to get a sense of who's here. You guys can stop me anytime. sharing, and happy to take any questions you all may have.